Are you feeling confused about choosing a career in medicine? Or maybe you are wondering what it really takes to study MBBS here in Nigeria or even abroad? Well, in this video, I am going to clear all your doubts about medicine and surgery. Yes, we are going to discuss about everything, right from the nature of the medical school, what MBBS is all about, the admission requirement, the challenges, how to overcome the challenges, the reward and job opportunities in medicine, and everything. So that by the end of this video, you'll have a clear understanding and comprehensive knowledge about what medicine and surgery is all about, and know whether MBBS is the right path for you or not. So if your ambition is to become a medical doctor, stick with me till the end of this video. But before we dive deeply into MBBS, let us introduce it even superficially. MBBS is an acronym. It stands for Bachelor of Medicine, Bachelor of Surgery. It is a professional degree and to become a medical doctor. During the course, you will study about human anatomy, physiology, biochemistry, diseases and treatment, health management, and many more. It usually begins with the theories and practicals in the laboratory before moving into the clinical practice, usually in teaching hospitals. Now, let us talk about duration. MBBS in Nigeria typically lasts for 6 years, although I prefer saying 6 sessions, from 100 level down to 600 level. Now, let me break it down for you so that you understand what to expect at each level. In 100 level, you will focus on normal sciences, that is your biology, physics, and chemistry. This gives you foundation to normal human body as well as science behind medicine. Although in some universities, you will also take the introduction to community medicine and the mathematics also in 100 level. 200 level and 300 level are very similar. So we even call them preclinicals proper. Here you will learn about the three core courses which include human anatomy, physiology, and biochemistry. In anatomy, you will learn about the structures of the human body, and it is usually categorized into gross anatomy. That is, you will learn about the structures that you can see grossly with the naked eye. The histology, that is the microscopic structure of the human body, you will learn them also. The embryology, that is the development of the human body, and also the neuroanatomy, which is mainly in 200 level. So this is for the anatomy. While for physiology, you will learn about the function and how human body works. And it usually begins with from the basic, that is from the cell, the tissues, then you progress into studying different systems, which include the respiratory system, gastrointestinal system, cardiovascular system, and many more. Then biochemistry. Biochemistry is basically the chemistry of life. You will learn about the chemical process in the human body, the molecular basis of life, the metabolism and energy production, and the many more. So you can see that by the end of your 200 level and 300 level, you will have completed all your anatomy, physiology, and biochemistry, and now be fully ready to progress into the 400 level, where your clinical experience and study of disease will begin. Now, 400 level. This is where you begin to move from theory into diseases and treatment. Here, you will learn more of diseases. You will learn about a lot of diseases. You will study pathology, which is purely study of diseases, and it includes histopathology, chemical pathology, medical microbiology, and hematology. Also, in 400 level, you will learn about pharmacology, which includes the study of drugs and how drugs works in human body especially. Now, at 500 level and 600 level, these are full clinical years. You rotate through major departments like internal medicine, surgery, pediatrics, obstetric and gynecology, and community medicine. So in these two levels, your focus is seeing patient, disease diagnosis and treatment, as well as applying everything you have studied. So you can see that this is just the super summary of what you are to expect from 100 level down to 600 level after securing admission into MBBS. Now, admission requirement. Let us briefly discuss what it really takes before someone gains admission into MBBS. First, your O level. You need to have at least 5 credits, which must include English, biology, physics, chemistry, and mathematics. And secondly, UTME, that is JAM examination. Also, the candidate need to have a very high JAM score, usually 250 and above in most of our federal universities. After this, some universities consider doing post-UTME screening, which may be the examination we usually call post-UTME examination or an interview. That is the simple interview depending on the university. Let us be honest, MBBS is highly competitive to the extent that only top performing students get admitted. So if you are serious that you want to study medicine and surgery, early preparation and consistency is the key. After finishing all these 6 years in medical school, you are not yet fully independent to practice independently. You need to undergo a housemanship for 1 year and national service of another year, where you will work under the supervision of senior doctors in order to gain more experience of clinical practice. It is only after you finish these stages can you fully practice independently in Nigeria. Now, career opportunities. Studying MBBS opens many career paths. You can work in public or private hospitals as medical officer. You can choose to go further and specialize in areas like internal medicine, surgery, pediatrics, obstetrics and gynecology, and others. You can go into public health, research institution, and the many more. The opportunities are actually many, depending on your interest. Now the challenges. MBBS is not simple journey. It requires patience, hard work, dedication, consistency, and determination. You will read a lot, attend several clinical postings, pass many professional examinations, and others. To succeed, you have to stay consistent with your studies. Manage your time well. Don't wait till exam before you start studying, and also focus on your goal. Now, my final advice is that before you choose MBBS, ask yourself these questions. Do I truly have interest in medicine? Am I ready for long years of studying? Can I stay committed even when things get high and hot? If all your answers are yes, then I think MBBS might be the right option or path for you. Finally, this is just a brief overview of MBBS. However, in our subsequent videos, we will take some aspects and discuss them in much more greater details so that you can fully understand what really lies behind. If you found this video helpful, don't forget to subscribe, like, share, and drop a comment. In our subsequent video, we will be diving deeply into pharmacy, so don't miss it. Now, what is your perspective about medicine and surgery? I am waiting your responses in the comment section. Thank you for watching. Till we meet in our next video.